And Dr. David Hirschwerk joins me now. He's an attending infectious disease specialist at Northwell Health. Dr. Hirschwerk, thank you for joining us and for all that you do. So CDC data shows more than 40% of U.S. counties are in the red zone with high community transmission. How do we stop this surge from getting worse, particularly as we have seen attitudes become increasingly lax?
Yeah, well, those are the things that will trigger increased rates of transmission. The rates that are going up are related to the fact that more and more things are opening, as well as the fact that we do have variants that are penetrating different communities that have a higher degree of risk of transmission. So those are the main factors. At some point, we will vaccinate enough people that we are able to, with that, significantly lower the rate of transmission. But we're several months probably away from hitting that point.
Well, nearly 100 million people in the U.S. have received at least one dose of the vaccine. That's 30% of the population. What sort of impact does this have on our ability to slow the spread, and how far away are we still from herd immunity?
Right. So that's great that we have 30% of people having received a dose. And when you take that number and you combine it with the number of people who already have had COVID and have some degree of immunologic protection from that, the numbers start to creep up and you get to roughly, and this is best estimate, around 150 to 160 million people who have some degree of immunologic protection from COVID. But that's still below the 75 to 80% that we need to have to get to what we estimate will be herd immunity. And herd immunity doesn't mean that there will not be any virus transmission. It's just the estimate of a percentage of people that have immunologic protection sufficient to significantly reduce the rate of transmission.
And Pfizer says that its vaccine protects against COVID-19 for at least 6 months. Is this a normal window of protection? And might this mean that people will need to be revaccinated in the near future?
Yeah, I think that we don't really know how long we would have expected there to be protection for. I think that the best estimate would have been a minimum of 6 months, but probably much longer than that. The longevity of protection probably has to do in part with the health of the individual being vaccinated. So can envision a situation where younger people are going to have a more robust and long-lasting response compared to somebody who may be of more advanced age or have certain underlying medical conditions. But we'll keep taking a look every few months of the people that receive the vaccine and see. But I think that it's going to be at least 9 months to a year, and maybe longer. In terms of the need for boosters as time goes on, I think it's a little early to know for sure, but it would not be surprising if on a year-to-year basis we all need to get some degree of boosters. But I think time will tell with that, and that'll be something that we'll just really need to keep a close eye on.
All right. Well, data from the company's ongoing clinical trial also suggests that the Pfizer vaccine is effective against variants, including the one that was first identified in South Africa. How significant is this?
I think that's huge. And I think that as much as the story has recently become the concern for the variants, and there's no question that that really is the main story with COVID right now, these variants, the fact remains that these vaccines are incredibly helpful, even when we are talking about the variants. And there was good news today about the Pfizer vaccine's effectiveness against the 351 strain. That's the strain that there has been a lot of concern of the effectiveness of the vaccines to neutralize that strain of virus. And I don't think that we know everything about how well the vaccine will neutralize that virus. But what the vaccine will do for all of the strains is significantly reduce the risk of progression to severe illness that makes it so that people are sick enough that they need to be hospitalized or can even die from COVID. So the vaccine has tremendous value, both with the original strain and with any of the variant strains. And I think that is really excellent news.
One last question for you, Doctor. The FDA has authorized 2 at-home rapid coronavirus tests that will not require a prescription. They will soon be available at pharmacies and grocery stores. What more can you tell us about these and the ongoing importance of testing?
I think testing remains very important. I think we can't get away from testing. The vaccines will be what eventually pulls us out of the pandemic. But you would have hoped that these types of tests would have arrived to us months and months ago. But that doesn't mean that even with the arrival of vaccines, that these at-home tests will not have value. We know that, for example, children will not be vaccinated for quite a while at this point, even though there's good news about young teens having benefit from the Pfizer vaccine in a recent trial. So we're going to have to still have the availability to do testing. And I can envision it being done in kids. I can envision it being done before events, particularly those events that attempt to bring larger groups of people into an indoor environment. We'll be living with COVID for some time, and the ability to vaccinate as many people as possible and to test people when necessary, they're all important things that eventually will help to pull us out of this.
All right. Dr. David Hirschwerk, thank you.
Thank you.